Morning, everyone. In the interest of time, we will begin. My name is Aditya Lati. I'm one of the Grand Round directors, along with Drs. Alex Harris and Rebecca Muley. Next week, we're doing something a little bit different. We're highlighting a new initiative in our department that has been focused on bridging clinical services with research training. The specific talk that will initiate this series is called Growing Together, a pilot program to advance clinical education research collaboration through quality improvement. This will be presented by three of our clinical fellows, Drs. Crystal Wang, George Dennefield, and Rohit Mukherjee, and will be led by Dr. Elizabeth Ford. This will be in person, and we highly encourage you to come. And we'll have coffee and pastries, but it also might stimulate new collaborations. If you're on the basic research side, you'll get to interact with clinicians and vice versa. Today is a special Grand Rounds that celebrates Hispanic Heritage Month. And to invite today's speaker, to introduce today's speaker, I'm going to invite one of our own faculty, Dr. Cristiane Duarte, who is the Rowan Professor in the Department of Child Psychiatry. For those online, please feel free to post questions anytime during the talk. Use the Q&A feature, and if you're a trainee, please put in screaming capitals, trainee, because we really like to highlight trainee questions and contributions. All right? Thanks so much. And please welcome Dr. Cristiane Duarte.
Hello, everybody. Can you hear me? Okay, so I'm so grateful today to introduce Dr. Seth Schwartz on behalf of the NISP Office of Fairness, Inclusion, and Professional Development, OFIPTI, as part of our Hispanic Heritage Month. Dr. Schwartz is a professor at the Department of Educational Psychology, University of Texas in Austin, a position to which he transitioned in 2021 after spending 20 years at the Miami School of Medicine. Dr. Schwartz, who is a native of New York, has a master's degree from Florida State University and a PhD in developmental psychology from Florida International University. His research focuses on crisis migration, cultural stress, family relationships, and their relation to mental health and substance use. I think of his work as the core science that underlies our understanding of the impact of culture and mental health. We are so used to using labels like Hispanic or Latina as if they capture the meaning of what it is to have a certain cultural background. Dr. Schwartz's work goes far beyond that. He unpacks what certain identities actually mean, conceptualizing key notions in the field, which he then goes further and operationalizes for empirical examination. This involves concepts like acculturation, bicultural stress, and identity conflict. His work moves us beyond naming specific groups and paves the way forward towards understanding mechanisms that connect culture and mental health with tangible effects to improve prevention and treatment. His CV lists 470 peer-reviewed publications, 510 if you include the book chapters. His H10 index, according to Google Scholar, is 381, with more than 60,000 citations. He's senior editor of the Handbook of Acculturation and Health, and also the editor-in-chief of the International Journal of Intercultural Relations. He has supported countless trainees and received the Outstanding Mentor Award from the National Hispanic Science Network in 2019. His NIH grants are too many to count, including 3 active R01s, reflecting consistent support from NIDA and NIMHD, the National Institute of Minority Health and Health Disparities. Current topics he's working on are alcohol use and mental health problems among families who relocate to Florida after Hurricane Maria in Puerto Rico, the experience of Venezuelan families in the diaspora, e-cigarette use among college students in Texas. After reviewing his CV, I must say I'm not surprised when I learned that he's also an avid runner, having completed 70 half marathons. I'm so glad that Dr. Schwartz has accepted our invitation to speak to us in the Hispanic Heritage Grand Rounds. I know that the work that he will share today is of more important now than ever. Please let's welcome Dr. Schwartz.
Wow, thank you so much. That I am really humbled and honored by that introduction. I hope you all can hear me. If you can't, if you see me saying stuff that you can't hear me, please let me know. But probably the most important thing about me right now is that I am a huge fan of the Yankees, and they just barely pulled it out yesterday. So very really happy about that, and hopefully they can do it again today. Anyway, so I'm going to talk to you about some of the work that my team and I have been doing on crisis migration, cultural stress, and mental health among crisis migrant populations. So first of all, I don't have any financial relationships to disclose, so I'm good. Just some learning objectives for this talk. I'm hoping to help you to be able to spot symptoms and indicators of crisis migration, to be able to identify sources of cultural stress in crisis migrant populations, and to be able to develop plans for working with crisis migrant populations, individuals, families, and communities in your own work. Okay, so let's go ahead and get started. One thing that we know is that not all migrants are equal or the same. So essentially, John Berry is one of the founders of this field. And he and his colleagues have listed several types of migrants who we assume are going to stay permanently. These include voluntary immigrants, people who come by choice for work, education, family, just because they want to. The biggest point is that they come because they want to, not because they have to. Refugees are displaced by wars or natural disasters and are resettled by the United Nations, by other governments, by aid agencies, etc. Usually, the UN only designates someone as a refugee if they're displaced by war. So usually people who are displaced by hurricanes, earthquakes, issues in their government, they're not actually labeled as refugees, and they don't get resettled. They may have to move as an asylum seeker, which is someone who leaves their homeland under duress and has to seek a country that will accept them. But if we ask ourselves, do all migrants fit into these three groups? The answer is no. These categories may not include people who are displaced in very large numbers by wars, natural disasters, or governmental collapses. For example, people in Venezuela who are displaced by essentially the collapse of their country, have been leaving in the millions. And many of them don't actually seek asylum in the countries that they go to. People from Ukraine are often not labeled as refugees. They have to move on their own. What about people who are not placed into camps, who are not resettled, and who do not ask for asylum? What about them? People who spread out from the epicenter of the disaster and settle in both nearby and far away countries. People who have to cross large bodies of water, who have to cross very, very dangerous areas of land, where many people die, and people who actually cross into the country that they're going to without authorization. In many cases, there really isn't a good heading for these people. And so essentially, Jane McAdam, working about 11 years ago, introduced the term crisis migration to cover these kinds of individuals. And we have used her framing in a lot of the work that we do. Some of the waves that are happening right now include Syrians fleeing the civil war in their country that is unfortunately still going on. People again from Venezuela who have been fleeing the dictatorship in their country that has been there for more than 20 years. Ukrainians fleeing the Russian invasion, and Central Americans fleeing gang wars and street violence. You could probably also add people from Afghanistan to this list. So in each of these cases, people have left their homelands by the millions. So in a lot of cases, crisis migration is a very, very large amount of people that are moving. People have settled both in nearby countries and in faraway countries. Large countries in the global north, the US, the UK, Germany, Canada, etc., have received large numbers of each of these groups. But neighboring countries often receive the largest numbers. And in a lot of cases, individuals and families leave without having time to plan or even actually having a sense of where they're going. They just have to get out. And in a lot of cases, again, the journeys involve extremely grave danger, and many people do not survive. I'll give you some examples as we go on. When we actually began this work probably around 2017 or so, after Hurricane Maria in Puerto Rico actually displaced hundreds of thousands of people. We tried to subdivide the climate-based crisis migration from crisis migration due to wars, due to bad governments, etc. But it's not always easy to draw such a sharp distinction, because essentially a natural disaster does not affect everyone equally. There's also a human disaster inside the natural disaster, and I'll tell you what I mean. Essentially, the term social vulnerability refers to the people who are going to be most hit and impacted by the disaster, and it refers to having fewer resources to be able to prepare. You don't have hurricane shutters, or you don't have a basement that you can go down to if you need to. You're not as able to access food, water, having power, etc. after the disaster. So you are more likely to basically have to leave. Your house is not able to withstand the hurricane or the earthquake or the flood. And not having social resources and contacts that can help you after the storm. People that are more socially vulnerable are often those that have to migrate after the storm. So basically, Hurricane Maria hit Puerto Rico a little bit more than 8 years ago. And writing just after the hurricane, actually Garcia Lopez said the following: almost a month after the hurricane, about 36% of people connected to the public water system in Puerto Rico were without access to water. This amounted to nearly 1 million people. These numbers also showed stark rural versus urban inequalities. Although 80%, I'm sorry, although 80% of clients in the metro area, San Juan, had water by that time. In the West, which is highly rural, it was only 45%, and in the North, it was only 32%. By November 6th, 46 days after the hurricane, 17% of rural clients were still without water. And at day 70, 10% still didn't have water. So this author goes on to say that in Puerto Rico, a popular saying in this period has been that hurricanes are natural, but disasters are political. So is it a natural disaster, or is it a human disaster, or is it both? So essentially, people who are more socially vulnerable are more likely to get pushed out after the disaster. Their house has been destroyed. They don't have food. They don't have water. Their place of work doesn't exist anymore. They basically have lost just about everything, and they have to leave. And so the migration may actually make mental health problems worse. About 6 months after Hurricane Maria in March and April 2018, we did a study of Hurricane Maria survivors who were still in Puerto Rico. We compared them to people who had actually left and gone to Florida. And if you look at people who screen positive for PTSD, in Florida, it was 22% higher than it was in Puerto Rico. Possibly even more importantly, if we look across both Puerto Rico and Florida, people who were living in urban areas were significantly less likely to meet screening criteria for anxiety and PTSD, and almost significantly less likely to meet screening criteria for depression than were people who lived outside of cities. So the bottom line is that people in cities often have the resources and the infrastructure to be able to recover. People in the country, people who are in highly rural areas, they don't have the ability to do that. And so these are the folks often that have to migrate after a hurricane. Okay. So looking at some of the human disasters that have also pushed out lots of people. Civil wars, invasions, as what has happened in Ukraine, in Iraq, in Afghanistan, looking at essentially coups where the government gets taken over, essentially genocides, gang violence, and essentially collapses of a whole country, as has been happening in Venezuela. So we will talk about a couple of these examples here today. So in terms of who is actually most likely to get pushed out, it's important to look at the map and to look at the difference essentially between the global north and the global south. Except for Australia and New Zealand, which are in the south, but they're officially in the north, and Ukraine, which is now in the global south, although it's actually in the north on the map. The map pretty much shows you that the countries in the northern part of the globe have most of the world's affluence and power. The countries in the southern part of the map have most of the world's poverty. And so that helps to explain why people from the global south are most likely to be displaced. So global south countries are more likely to be invaded or conquered, to be devastated, not just hit, but actually devastated by hurricanes, earthquakes, floods, wildfires, etc., to be engaged in civil by unstable or corrupt governments. Widespread sectarian violence, to be ravaged by droughts and plagues and mass starvation. To be targeted by successful terrorist attacks. People in New York can remember what happened on September 11th. And obviously, that was absolutely horrible. There are other parts of the world where things like that happen all the time. And characterized by mass poverty and very, very small pockets of wealth. So all of these are reasons why crisis migrants are usually from the global south. So this is because the resources that are available are not adequate to be able to handle disaster events, because the governments are not able to stop violence, and in some cases the governments are actually causing the violence, because elections are less likely to be free and fair. So the governments are not actually responsible to citizens. They don't actually care. Poor people, who are most of the population, literally have almost zero power. And invasions and whole collapses in a country are much more likely in the global south. And essentially, crisis migrants go anywhere that they can go. Most of them actually wind up in a neighboring country. So if we look at the example of Venezuela, the largest numbers of people went to Colombia and to Peru, which are essentially right next door. Um, um, but the US, which is actually really, really far away, has received, I think, by the time Joe Biden left office in January, we were about, I think, 750,000 Venezuelans in the US, despite the fact that the US is really, really far away. So usually what happens is that people who are able to go to the global north, they go. These are the people who have resources, who are educated, who have someone that they know in the country that they're going to. Everybody else has to go anywhere that they can. Okay, so the group that has been quite unique is the Ukrainians, because they have direct access to Europe. So if we look at this map from about 1 month after the invasion, most of the people who left Ukraine went to Poland, which is literally right next door. Other countries, including Russia itself, actually received large numbers of people from Ukraine. So now I want to talk some about what actually happens to crisis migrants, and how can we help them. So a lot of the work on crisis migration specifically has focused on what happens before the migration. The focus is largely on the disaster itself and what happens right afterward. But most work on cultural stress, things like discrimination, things like feeling shut out, things like having difficulty communicating in the new country because of the language. These things have actually focused on what happens after the migration. But what we have actually tried to do is to integrate these two things like so. So what we've actually proposed is that crisis experiences in the country of origin or the region of origin actually help to lead to these experiences of discrimination, of what we call negative context of reception, which is, in a sense, even if there isn't anything that happens, I still feel like I'm not necessarily wanted. I still feel like people don't want me here, people don't want to talk to me. I show up and suddenly everybody leaves. And I have issues with the language. People who have to migrate without planning, they don't have the time to be able to learn the language. They just have to leave. And so these two sets of things both actually predict lower well-being and higher mental health challenges in terms of anxiety, depressive symptoms, and PTSD. So what we've actually proposed is that, first of all, going through the crisis makes people more vulnerable to experiencing cultural stress after migration. Because people have a sense that the world is not safe. People have a sense that other people are not going to help them, and so that increases the perception of feeling shut out. But I think it also sends a signal to people in the new context that these people may be targets for discrimination. We also, as I'll show you in a second, have found that the crisis experiences happening before migration can actually interact with what happens after migration to actually predict mental health and well-being. Cultural stress experiences can also mediate the effects of crisis experiences on mental health and well-being. So what have we found, and what does it mean for how we should be helping these people? So far, we have actually conducted research on 3 crisis migrant populations: Hurricane Maria survivors from Puerto Rico, most of whom wound up in the Orlando area. About 80% wound up there. The Venezuelan emigres, about half of whom are in Florida. In the US, we've also included people who went to Colombia as well in some of the research that we're doing. And people from Ukraine who came here either after the invasion or even before the invasion, but after some of the earlier conflicts with the Russians, and I'll explain what I mean in just a minute. So there are some common themes and some differences. So anyway, these are the groups. The hurricane survivors. Now, I'm sure everybody knows that Puerto Ricans are US citizens, but when they migrate, they are often treated as though they are not. One reason is because the official language, Puerto Rico, is Spanish. And most people outside of the San Juan area do not speak English very well. The culture in Puerto Rico is more similar to other Spanish-speaking islands than it is to the US culture on the mainland. The quality of life, simply because of economics, is actually below that of the mainland. I mean, at this point, people are used to the power going out almost every day. Many educated professionals, doctors and scientists, etc., they've already left. And so, for example, I have a good friend whose family lives there in Puerto Rico. Her mother cannot find a doctor because the doctors are all here. The economy in Puerto Rico has been essentially down for almost 20 years. And so even before the hurricane, a lot of people were leaving. And also, most people in Puerto Rico are dark skinned. And many of them experience essentially racism on the mainland. Okay, so the hurricane itself happened a little bit over 8 years ago. It was one of the worst hurricanes on record in US history. The winds were essentially 155 miles an hour. The rain was so bad that areas were flooded within a couple of hours. Much of the island had literally zero power for half a year or more. People did not have any water to drink. And if we look at this radar map, look at the size of the hurricane. Look at the size of the island. This is what happened. This is what was actually happening during the storm. I can tell you, hurricanes are not fun. I was in Florida for a lot of years, and I've been through several of them. But if the houses are not built to withstand the storm, what you have after the storm is this. You have a situation where everything has been essentially destroyed, and people have to get out. So after the storm, between September and probably March or April of the following year, over 300,000 Puerto Ricans went mostly to Florida on ships and planes. About half of these people went back, and even now, about 150,000 are actually still on the mainland, mostly in the Orlando area. Although there are some in New York. Um, um, Many of the people who migrated were poor and were from more highly rural areas on the island. Most of the people from the capital city wound up being able to go back. People from other parts of the island were not able to do that. So in our sample, the mean annual household income, and we actually started doing this research in March 2018. Our actual grant was funded in 2019. We actually collected our baseline data between summer of 2020 and fall of 2021. The mean annual household income for everybody in the household was around $30,000. And Florida is an expensive place to live. It's not as bad as New York, but it is expensive. So what happened was a lot of people couldn't find housing, and many of them were housed in hotels by FEMA for months, and these hotels did not have a stove or a fridge, and so people weren't able to cook, which of course isn't great. And so what we did in this study was we looked at hurricane trauma, which includes both loss of property as well as physical danger to you as a person. We looked at cultural stress in terms of discrimination, negative context of perception, and language stress. We looked at well-being in terms of optimism and life satisfaction. We looked at mental health, depressive symptoms, anxiety, and PTSD symptoms. And we looked at alcohol misuse, essentially heavy drinking, and consequences of alcohol use. So some of the findings that we had, this was one of the first articles that we had from this data set. You see that as we had expected, there is a direct path between hurricane trauma, cultural stress. cultural stress then actually predicts optimism, negative direction, life satisfaction, also negatively. Internalizing symptoms, which are again anxiety, depressive symptoms, and I think actually PTSD wasn't in this model because it didn't actually load on this variable, and so then internalizing actually predicted alcohol misuse, and so in some there was a direct path here, but then there were also indirect paths from hurricane trauma to all of these things indirectly through cultural stress. And then there was an actual double indirect path, 1, 2, 3. So the next article I'm going to show you here was one that was a latent profile analysis. We found 4 profiles. The first one, which was also the largest, was people who were doing pretty well. They really didn't have a lot of trauma. They didn't have a lot of cultural stress. This was almost half the sample. I think that's important to note, that a lot of people are doing okay. But if we look especially at group 4, which is the people who have certainly elevated hurricane trauma and then fairly high cultural stress, these are the people who are really not doing so well. And so if we look at it this way, class 4 against class 1, the people who are doing the least well versus the people who are doing the best. If we look at only symptoms here, higher symptoms of depression predicted almost 4 times the odds of being in the highest risk class as opposed to the lowest risk. Anxiety and PTSD scores were between 2 and 3 times. If we look at essentially screening diagnoses, people who had elevated PTSD were almost 7 times, no, I'm sorry, were almost 8 times as likely to be in the highest risk class as opposed to the lowest risk. And similar findings for anxiety and depression. So what we're seeing here is that what happens before the migration, after the storm, and what happens after the migration are very, very closely linked with people's mental health. So when you see people who are really, really, really not doing well, one thing that's important to look at is what happened during the storm and also what has happened after the migration. Okay. Looking at another colleague, looking at another article, actually, I'm sorry, that my colleague J.C. Hodges was lead author on. What he found is that essentially, if we look only at PTSD symptoms. Both types of hurricane trauma, both life-threatening trauma and also loss trauma, as well as all three of the cultural stressors, all predicted higher levels of PTSD symptoms. This is important so that people who were more impacted by the storm and then came here and experienced more cultural stress are much more likely to report PTSD symptoms. So the PTSD is not only what happens during the storm, it's also about what happens after they get here. I think that's really important to look at. What we find incidentally, or interestingly rather, is that essentially it looks like it's possible to get essentially maxed out on trauma, such that if the hurricane was really highly traumatic, then additional cultural stress doesn't actually make it worse. People who didn't have that many issues in the hurricane seem to be affected much worse by what happened after they got here. I think that's also important to look at, that there is a ceiling effect of how much essentially somebody can take. Okay. Looking, and I'm getting close to being done. Looking at the Venezuelans, I don't know that everyone knows all the history of what's happened down there. So I will very briefly go over it. So essentially, Venezuela was once the wealthiest country in Latin America because of all the oil that they have. But in 1998, Hugo Chavez was elected as a democratic socialist, and he immediately went after the wealthiest people in Venezuela. And so what did they do? They left. Many of them went to Miami. And so essentially, since Chavez died in 2013, he was replaced by the current leader, Nicolas Maduro, who has completely destroyed the country. And he did that by completely mismanaging the economy to the point where inflation was over 1 million % in 2018. And the only reason why it's actually come down is because the currency was devalued. He literally sent people out to attack those who protested. And he ran supermarkets out of business, so that there literally wasn't any food to buy at all. And so the average Venezuelan lost approximately 25 pounds in 2017, not because they wanted to, but because they just weren't eating. And so the mass exodus began in 2014, accelerated in 2016. And so I think by now it's up to, I think, 3.3 million people have gone to Colombia since 2017. I think approximately 800,000 went to the US by the end of Biden's term. And so at the beginning, people were able to fly directly to the US. But those flights were ended by the Venezuelan government in 2018. Then people began to fly to Mexico and cross the border, but the Mexican government said, "I don't think that we're actually going to let this happen," and so that stopped. And then until 2024, people were actually literally having to walk. So we have actually two studies that we've been doing on Venezuelan migrants in the US and Colombia. The first one was our pilot data collection 8 years ago. We had about 650 adults in the sample, about half and half across the two countries. Our funded study started in April 2023. Currently, what we have is 566 adults, 429 adolescents. And I think we are currently finishing wave number 4, although actually the results I'm going to show you are from baseline. So some of the findings that we found, my former student Saskia Voss, what she found was that essentially only for women, not for men, higher discrimination was linked with higher PTSD symptoms. Okay. There's an article that I led about 7 years ago. What we found was that in both of the countries, negative context of perception actually predicted discrimination, which then predicted symptoms of both anxiety and depression. We also found, we were really, really surprised by this, that actually both discrimination and negative context of reception were actually much higher in Colombia than in the US. We were expecting the opposite, but that didn't happen. Okay. Okay, so a couple of more sets of findings. My friend Chris Salas Wright. What we did here, we actually designed a measure of crisis migration, and we found 4 subscales inside the measure. Hardship, like being hungry. Desperation, we have to get out. Danger, it's not safe to be here. And unplanned departure, we have to get out now. Another article by Chris here. What he found, very, very similar to the Puerto Rican study. People who were actually maxed out on trauma in Venezuela, essentially discrimination in the US or in Colombia didn't actually affect them very much. And these findings were for both adolescents and adults. Okay, and finally, I'm almost done, folks. Looking at the Ukrainian war migrants, just a little bit of background there. Russia and Ukraine have been in conflict since about 2014, when the Russians invaded eastern Ukraine. And also Crimea. And in fact, a lot of people came to the US after that. However, in early 2022, the Russians decided to invade the whole country. And so the invasion has displaced a lot of people, mostly to Poland and other Eastern European countries, as well as to the US and Germany and the UK. The US launched an initiative to bring people here in 2022. Unfortunately, that was actually canceled after Biden left office. As of early 2024, over 500,000 people had actually come to the US since the invasion. And so yes.
I'm sorry, we're running precariously close on time. I'm so sorry to interrupt you. If you could just wrap up in the next minute or two, and we could move to the Q&A phase, because we have questions as well. Thanks.
Okay, this will be my last slide then. We can actually, I think I may have one more after this, and then we will wrap up. So what we found here, was that those people that came after the invasion were higher on depressive symptoms, anxiety, PTSD, language stress, family economic stress, and pessimism, as well as alcohol misuse. And the last one I'm going to show you, we actually did a latent profile analysis. And what we found was low, medium, and high stress groups. And so the people that came after the invasion, they were overrepresented in the high stress group. Mental health was also really, really striking. If you look in the high stress group, almost all of them hit criteria for anxiety and depression and PTSD. And that is where I will